We were pathetic. He was absolutely right. They scored 28 points in the second half too, and we got beat 56-0. I was a sophomore year. Our senior year, John Cottingham was quarterback, Cotton or Johnny Boy. We had a winning season, 5-4-1, but it's still a winning season. They hadn't had a winning season at Laurinburg High School in forever. In case you're wondering, John can tell you every play of every game that we played that senior year. At that time, Mrs. Myers was on the faculty at Laurinburg High School. And Mrs. Myers, I'll never be able to call you Betty. You will be Mrs. Myers forever. By the way, Laurinburg had a very strong faculty, which well prepared us for college and for later life. We were blessed with a very strong high school faculty, for which I've always been grateful. I didn't grow up yearning to be a doctor. In fact, when I enrolled in college at Davidson, I wanted to be an architect. This is because of Mike Mirachel's husband, Mr. Charlie Cox, who taught me a drafting course. It was in drafting and industrial arts. It taught you to draw things in perspective, in, all the right size, to scale. It was kind of a hard course. Our final project was to draw a set of house plans, complete with the floor plan and the outside elevations and the types of windows you use and all that kind of stuff. And I drew plans for a split level, 5-bedroom ranch house with a 2-car garage. And it was my dream house. Mr. Cox liked it too. He gave me an A. And I said, I'm on my way. I'm going to be an architect. So I went to Davidson. And unfortunately, my freshman year, physics and calculus canceled those plans right quick. I was okay until the end of my second year, sophomore year. You had to declare a major. I said, what am I? I said, I'm going to be pre-med. Because everybody at Davidson was pre-something. You know, you weren't just, you were pre-this or pre-that, pre-this or pre-that. I bet Mac was pre-ministerial when you were there. Oh, that was pretty fun. I chose pre-med because it sounded pretty good. It sounded pretty good to me. It sounded pretty good to my folks. It sounded pretty good to some of the girls I dated. So then I graduated in 1966 with a pre-med major. And I went to Chapel Hill in med school, I guess by default. What else was I supposed to do with a pre-med major? You know, I guess I could have gone to law school. At med school, I was lucky enough to meet a young nurse who was Linda McGowan while we were playing tag football. She was working in the psychiatry department at that time, and I really think that's why she saw something special, or interesting at least, in me. We started dating and were married after our second year of med school. One of my freshman classmates and lab partners was Jim Smithwick, a UNC chemistry major. I said, chemistry major, he'll be good in lab. So I latched on him as a lab partner. Incidentally, he played basketball at Chapel Hill on the Dean Smith coach team. I want you to keep that name, Jim Smithwick, and the term fate in mind while I proceed. Medical school was fun. It was really fun. It was also challenging, but it wasn't rocket science. You know, you have to have math and physics and rocket science, and I wasn't doing any math or science, so med school sounded great. And remember, not all of us were going to become brain surgeons. Some of us are just ordinary doctors going out to practice medicine in small towns and cities. At Annapolis, I think you might know this, they call the last midshipman in the class the anchor man. Is that true? Anchor, the anchor. I bet y'all know the answer to this question. But what do you call the person who graduates dead last in his or her medical school class? Doctor, you're right. Cross my heart, I was not last. I chose pediatrics because I admired the pediatrics faculty and house staff. And for the most part, it was a happy specialty. Also, pediatric patients did not come with a lot of baggage. You know, the multiple, overlapping, interacting medical problems, you know, the ones we have these days. It just, the umpteen medicines you need to figure out, and the truckload full of medical records that have to be reviewed. I admit it was a pretty pragmatic decision, but it was a good decision. As I said, it's a happy specialty. But of course, being in a teaching hospital, I did witness some serious pediatric conditions. Then, when tragedy struck a child, it was hard to cope. To be perfectly honest, that was hard. But when there was a cure, it was so much sweeter. Now, I finished med school, believe it or not. Then I entered post-graduation training. I was an intern and then a first-year pediatric resident at the Medical University of South Carolina in Charleston. Jim Smithwick, that name, also chose pediatrics in the Charleston residency. So we were still in kind of lockstep professionally. Fate, who knows? You can learn an awful lot in a busy city hospital with a trauma center, believe me. We worked hard for long hours at a time, and admittedly, we partied hard when we got the chance. Charleston reinforced my decision to pursue a career in pediatrics. The hospitals provided a marvelous environment to learn about treating the patient population of a general pediatric practice, and that's exactly what I wanted to do. I wanted to be a general pediatrician in a small town. We encountered not only the common illnesses by the hundreds, but also some rare diseases while serving on subspecialty rotations. My diagnostic and therapeutic skills were honed. I learned to observe, to analyze, to think some more, and then to act. We practice, everybody says you practice medicine. That's right. We practice the art of medicine in the truest sense of the word, utilizing our newly found skills to help out the patient population. Overall, we did a good job, I think, serving as a pediatric mecca for most of South Carolina at that time. It was an exhilarating experience. But after those 2 years in Charleston, the U.S. Army decided it was my time to serve. I was stationed at the 34th General Hospital in a small West German village. Although it was a true U.S. Army General Hospital, it was mostly mothballed, just in case the Russians came through the Fulda Gap and the proverbial balloon went up. In actuality, we only maintained an outpatient clinic and an emergency room with a pharmacy, limited lab facilities, and very limited x-ray services. How about childbirth? We offered natural childbirth. It was the only option offered. I did deliver one baby when snow prevented the expectant mother from being transported to the Longstool Medical Center, where we usually send our expectant mothers. The delivery went very well. I don't think it's much thanks to me. I think it was thanks to God and to the fact that this wasn't her first baby. Aside, due to my college ROTC commissioning in 1966, I was a senior medical officer there. Small facility, big building. But I was a senior medical doctor, hence I became the, get this, are you ready, military people? I was the commanding officer of the U.S. Army General Hospital. To put this in some context, Walter Reed is the U.S. Army General Hospital. That sounds impressive, doesn't it? Well, really it wasn't. And in case you're wondering, who actually ran this hospital? It certainly wasn't me. Most of the career military people will know the answer to this one. It was run by the senior non-commissioned officers, the NCOs, and in this case, the German secretarial staff. There was a second lieutenant who was the adjutant in the Medical Service Corps, and he was there, I think, mostly just to sign papers, sign orders, sign leave papers, and that kind of thing. But the hospital was run by the NCOs, and I was blessed to have good NCOs. The most extraordinary event of our time in Germany was the adoption of our son Jason. In Germany, there are no central orphanage or adoption system, so we'd often spend our days off going to city after city to visit the local orphanages. We found Jason in Mannheim and adopted him when he was 4 months old. He looks just like me. In fact, when people meet him, they do not believe he is adopted. And to this, Linda says, God is good. After our Army experience, we returned to Chapel Hill, where I completed my pediatrics training, where my medical career had begun in the first place. That year really flew by. I had begun med school in 1966. It was now 1976, and I was a fully trained, soon-to-be board-certified pediatrician. We moved back to Laurinburg to join 2 pediatricians in their group practice. The senior member was Dr. Bill Purcell, who many of you know. He was a more mature pediatrician and a recognized pediatric pioneer in North Carolina. I'd like to repeat that. Y'all don't appreciate Dr. Purcell as much as you should here in Laurinburg, the ones who knew him. He was recognized in the city and in the state and even in the nation as being innovative in his approach to pediatrics. It's so good to be with him. The other pediatrician was my aforementioned friend, Dr. Jim Smithwick. Fate. He is probably one of the most intelligent, smartest people I've ever known, and he never forgot anything. It was a perfect setting to begin my career in private practice. A little prior history of the Purcell Clinic that predated my arrival I think it's nonetheless informative. Dr. Purcell was also from Laurinburg, another Laurinburger. His partner was a Massachusetts General Hospital trained pediatric hematologist, Dr. Campbell McMillan. Dr. Mack, as he was known, was the son of missionaries serving in China, but he had very strong family ties over in the Riverton community. And for you people who don't know it, Riverton is a suburb of Wagram, just north of Laurinburg. Despite their best efforts that first time around, including walking their patients and their parents back to their cars after an office visit, going and opening up the office after an annual Christmas parade just in case some child fell off a float and got hurt, they'll be available to help him. Their first attempt to have a pediatric practice here in Laurinburg was a failure. So Dr. Purcell moved to Charleston to join a 5-man group down there, and Dr. Mack returned to academia. He became the first pediatric hematology oncologist at UNC School of Medicine. He was still there when I was a student in med school there, and he was quite a man to work with. He's a saint, he really is. Later, Dr. Purcell moved back home again, where he stated he was needed. Now, he was in a very prestigious, prominent practice down in South Carolina. I'm sure he could probably have been more successful money-wise there than he'd ever be in a career here. And he came back because he said, I was needed in Laurinburg. I wasn't needed in Charleston. He was in solo practice most of his time, but his practice grew. By the time I arrived on the scene a year after Dr. Smithwick, who only served 2 years in the Navy, well, I served 3 years in the Army, so he came here a year earlier. They had a thriving, active pediatric practice. The groundwork had been laid, but not by me. Dr. Purcell and Dr. Mack are 2 of my idols. And I'll be glad to sit down with anybody and talk to you about these 2 individuals anytime you want to. They're men to be admired and known about. Returning to Laurinburg just felt right for many ways. It is a decision I've never regretted. I was surrounded by medical colleagues, both then and later, with whom I had the utmost confidence and faith. That feeling of confidence and comfort is almost impossible to convey, especially to non-medical individuals. but it was real. It was very palpable that you could trust them always for everything, their friendship, their medical knowledge, and their devotion to our clinic. Another magical scenario emerged in Laurinburg. Our daughter Emily was born a year after we moved back home. We lived in the same neighborhood, within walking distance of our office, the hospital, our church, and the elementary school our children attended. My parents lived on Everett Street, just 3 blocks away. Eventually, Linda's mother moved to town onto that same street, so the grandchildren had all their grandparents close by, close enough to ride the bicycles down to see anytime they wanted to. And that was a great place to live, and what a great place to raise a family. For all you preachers in the group, I know pride is a deadly sin. But I am still proud to have been a pediatrician in the Purcell Clinic, which had a very good reputation for excellence. We were open 7 days a week, including Saturday mornings and Sunday afternoon clinic hours for sick children. We were available after hours for emergencies, often seeing those children in our clinic at night instead of going over to meet them at the emergency room. But we had to pretty much abandon that practice after a police officer informed us that certain members of society equated a doctor's office with somewhere that drugs were kept. And we did keep drugs. We had Tylenol, baby aspirin, antibiotic samples, even some baby formula. But I don't think that's the kind of drugs the officer was talking about. So we had to start seeing our patients in the emergency room. And to be perfectly honest, that was a lose-lose situation for everybody involved. It was harder for us to go through paperwork and all that kind of stuff and get a room. And it's certainly harder on the parents. But we were warned more than once that we were crazy to go down there at night. And so we quit doing it. While we were on call, our wives became very proficient at answering the calls at home and relaying messages to us by landlines. Several of the wives were nurses, including Linda. The reason they had to relay messages to us, that was before beepers, cell phones, and immediate instantaneous communication. This sounds like I'm bragging, and I am. We cared for our patients, we cared for our pediatric patients and newborns, both in the regular nursery and the neonatal intensive care unit. We attended C-sections and other high-risk deliveries. Our OB colleagues were wonderful physicians. To simply hold a newborn infant and feel him or her take that first breath is an event that few of us have had the joy of experiencing. To be able to help them take that first breath and stabilize them was awesome. Honestly, I can't stand up here and say I jumped for joy when I got a call in the middle of the night for some emergency situation that I had to get up and go to, but it got my blood flowing and my mind working. These were the rewarding, exciting parts of being a doctor. I cannot imagine practicing medicine and not doing it. That is the essence of being a small-town general pediatrician. Pediatrics, like medical school, was, as promised, mostly fun. But like medical school, it was also challenging. We had to treat the children while dealing with the parents who were often very worried about their children, but who trusted us with their most precious, treasured possessions. So some stress was involved in this profession. I must tell you, for full disclosure, that I did take a 3-year detour in the middle of my medical career away from private practice. For that 3-year period, I left private practice to work for the state developmental evaluation centers. Seeking what? Maybe shorter hours, maybe no night call, maybe no weekend work, maybe all of that, maybe less stress. Linda said had a very simple answer. She said it was my midlife crisis. Probably so. While I did learn a lot about various developmental handicaps, I came to appreciate that I was a general pediatrician at heart and missed the variety of patients and the ongoing professional relationships of private practice. When the opportunity arose, I rejoined my colleagues at the Purcell Clinic as fast as I could. Lesson learned: the grass is not always greener. Now's the time I feel I need to tell you why I think my life experiences were extraordinary. I had the honor and privilege to study, train, and practice medicine during what I feel was the golden age of medicine. I witnessed so many advances that directly affected pediatrics. Neonatology. Neonatology is taking care of newborns, whether they're full-term newborns or premature newborns or sick newborns for any reason. But you couldn't have neonatology unless you had teeny respirators that wouldn't blow out the baby's lungs, that gave very puffs of blood instead of push of blood. It did not develop into its own specialty until these respirators were present. You also had to have infusion sets with tiny delivery systems so you could give medicines, blood products, and IV fluids to an infant. So I saw the time when sick, full-term, and premature infants who previously would have succumbed to the very fact that they had a disease, a treatable disease, or just they had early births and low birth weights, they had not survived. They had died, but they began to live and to thrive. In the area of imaging, CAT scans. Everybody's heard of CAT scans, MRIs, sonograms. We didn't have those when I started. I mean, it's hard to believe that we didn't have those. They weren't around. They hadn't been made. In the area of laboratories, microtechnology. It got so we could do a whole lot of lab work, tests on a very small bit of blood to give us the information we needed to handle these pediatric patients. It used to be they thought nothing of coming in drawing a half a pint of blood to do some lab tests on. You know, you draw a half pint of blood from a baby and that kills them. You can't do that. So microtechnology really changed things, as did the development of sophisticated rapid tests for different infectious disease and other things. Y'all are all familiar with a rapid test for the virus, you know, the flu. What do we call this? COVID. You know, for COVID. I bet everybody stuck that thing up their nose one time while you. That was all. That technology was developed. I know pharmacology has a bad rap. Big pharma's a big bad bear. But pharmacology advancements gave us more effective antibiotics against infectious disease. It gave us better, improved anti-asthmatic medications, advanced, more focused chemotherapy, and new methods to administer all these medications as well as old medications. But just the fact we had different ways we could administer the medicine made all the difference in the world. Oncology, the treatment of cancer. There were advances in the diagnosis, in surgery, chemotherapy, and radiation therapy. Cure, the word cure, as opposed to remission, became a reality. For instance, childhood acute lymphoblastic leukemia, previously 100% fatal disease when I was in med school, was now curable in most cases. Another example, moi. I'm a 25-year cancer survivor. And the reason I survived this long is because I had early diagnosis and effective treatment. Now, I'd hate to think that I was just in a long remission and I hadn't been cured. I think I've been cured. So cancer can be cured. Another thing not many people think about is the transport of critically ill patients to medical centers. We went from using funeral home ambulances to the air age with specialized helicopters and professional paramedical teams to handle the patients in transport. We did go through a transition period when we actually got into an ambulance ourselves with the patient or an Army helicopter with our patients to accompany them to Duke or Chapel Hill. Sometimes we had to assist their breathing all the way with a handheld ambu bag. But usually we had an experienced pediatric nurse to help us out. The helicopter put us out. We took baby into hospital or child into hospital where we were, come back out, get on the helicopter bring us back to Laurinburg, then it fly back to Fort Bragg. Vaccines. I can't say enough about vaccines. They didn't cure illnesses, they prevented them, and that's a game changer. In fact, my younger colleagues have never even saw some of those diseases that damaged or killed children early in my career. Specifically, I'm naming Haemophilus influenza meningitis and pneumococcal meningitis and sepsis. Those kids would get that, and a lot of them did not make it. Other areas of medicine saw the development of things now considered almost routine. They had an indirect effect on pediatrics. Therapeutic heart catheterizations. I dare say there are plenty of people in here who have had a heart cath where something was done to them during the cath. They weren't just looking, they were treating. Arthroscopic, endoscopic, and robotic surgical procedures. Organ transplants, even multiple organ transplant. Hospice services, and the list goes on and on. It was just an amazing time. Upon retirement, Lynn and I moved to the Outer Banks for Outer Banks of North Carolina for 10 years. Then, seeking a retirement community, we returned home to Laurinburg again. In retirement, I must admit that the whole anti-vax movement has vexed me. Seeing the resurgence of infectious diseases that we had eradicated in the United States and throughout much of the world is heartbreaking. Criminal is another word that comes to mind. I'm also perplexed by the medical maze my son Jason, who is a diabetic, must traverse in seeking medical care. When he finally gets to the physician or the other medical care provider, his care has been very good or excellent. But dealing with insurance companies, medical networks, telephone tree answering services in that maze has been frustrating, to say the least. I have not really experienced that locally. Maybe that's simply because I am still considered a member of the medical fraternity. I don't know. Perhaps that's not true for the rest of you people who are not as lucky as I am. I really don't know. Maybe you can fill me in on that. I've also been disappointed by the contentious medical legal landscape. It has encouraged many physicians to retire early or to abandon certain specialties such as OB. I am not naive enough to think there's no real medical malpractice out there. There are a lot of physicians who probably should not be practicing, and the medical community maybe not has been as vigilant as they should in getting rid of doctors who should not be practicing medicine. But I really think that the medical profession has been a victim of its own success. When somebody gets sick, they expect to get well. When someone has surgery, they expect everything to come out okay. And in life, stuff still happens because nobody's fault. And this, unfortunately, a lot of these have been played out in court, but that's my point of view. Of course, I'm a doctor. One of the benefits of returning home again is the joy that occurs when somebody comes up to me and says, "Dr. McQueen, is that you?" Or, "Didn't you used to be Dr. McQueen?" Or that difficult one, "Do you remember me?" I usually don't remember them, and I admit so. Some are better, and they say, "I know you don't remember me, but..." Then they proceed to tell me about what I or we at the Purcell Clinic did for their now grown child or children. Even these many years later, their memories of the event are vivid, and they're so appreciative. I regret I don't share their clear recollections. Often they show me a picture, a wedding picture, a graduation picture, or even a picture of their now grown children with children of their own, the grands. That feels good. Those are punctuation marks for some of my exceptional life experiences. But in actuality, I was just doing my job. What I was trained to do. in a manner that would please Dr. Bill Purcell. So yes, I am a native son. In response to those who may ask, the answer is yes. Yes, you can. Thanks to Scotia Village, you can go home again and again. Thank you.
Have you got the slideshow now?
Yeah. Good. I've got a postscript I added, and I'm gonna get in trouble for this. Okay, so probably the main reason that I have enjoyed what I feel is the most rewarding, extraordinary life is the presence, partnership, and full support of my wife. Amanda? For the past 55 years, she's been there. My greatest contribution to Laurinburg, by far, was bringing her here. Her legacy will outlive us all. She was one of 3 young women who had a dream, a wonderful dream that, coupled with hard work and devotion, established a hospice here in 1986. She was the first hospice employee, and for many years she served as a nurse and the executive director of Hospice of Scotland County, as it was then known. She oversaw and guided its exponential growth and success. Upon her retirement, hospice had its own administrative building and Morrison Manor, the inpatient hospice facility, debt-free. It served multiple counties in North and South Carolina. I don't know the exact numbers of staff members, volunteers, or clients served, but they were significant. But that's a different story, a story deserving to be told in detail on its own, because hospice is still here. Thank you. Ba-dee, that's all, folks.
Good job.
Thank you.
You want to preach that Sunday?